Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello, and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hey guys, Dr. Santhosh here, your pediatric infectious disease doc and a researcher.
Last week, assuming I aired this in the correct order, we did a journal club all about the fancy new tech and developments to improve people. But
Mm.
you know what we don't talk about as much when we talk about places of healing and the healing and all the medical things we do? We don't tend to think of the hospital itself. What role the
Okay.
building plays in healing. Like
Oh,
if you build
the
it, they will come, right?
sure, yeah, the physical, the actual building. I mean, I know I think about it a lot because I have sat on my hospital's epidemiology committees and biohazard committees and that kind of a thing. So I've had to work with people who are in construction facilities, all this kind of a thing to make sure that infection is well contained and doesn't spread around the hospital. But I'm guessing that's
Well, I
just one
mean,
aspect.
I don't know. It's something it's been sitting on my mind for a while now. Of course, I live in Chicago, which is a very architecture forward city.
Sure, sure.
Uh,
Uh huh.
if you've never been, I know you have, Santosh, but I'm
Oh
talking to
yeah,
our I'm talking to our
yeah.
listening audience. So
If y'all have never been, absolutely, yeah,
the architecture river tour, or
yeah.
Devil in the White City, both great places to find a lot out about architecture. Uh, Now, we've done an episode in the past on how disease influenced architecture and design.
And I think we've also covered how disease has influenced fashion as well, which was a fantastic episode.
So, yeah, these intersections that are just tangential enough to medicine that I can still, with plausible deniability, claim that that's what I was researching all along.
Yeah. And I personally love it because a lot of the time it comes down to, an infectious pathogen or something like that, which is the disease of influence.
So, this week, we're going to focus on designing medicine. Um,
Yay.
or like you were making fun of me for Santosh, designing women, but a show that no one will remember.
Yeah, give us a shout out of those of you who are old enough to have seen Designing Women on terrestrial TV.
What, you think they're listening to this podcast from their space televisions? Do you think we have a listener on the ISS?
No, no,
Oh,
no. That would make my life, I think. That
right?
would be, oh my God. Yeah, that would absolutely make my life.
We got to
If
go
if
talk over to our space medicine consultant about this.
Yeah,
Anyway,
yeah.
we
I
don't
love it.
we don't tend to think of architecture or interior design as something that could produce tangible medical benefits. Like, it's a hospital. Who cares what it looks like? Let me tell you. Think about it, Santosh. I'm going to ask you what sounds like a very simple question. Close your eyes
Mm,
and picture a hospital from the
okay.
outside
Right, right.
and then from
Now,
the inside. What does it look
yes.
like to you?
Okay, outside. Um, the hospitals that I've served in over here, as well as those that I have been, I've been in Miami, I've been in Chicago. Very standard, rectangular or square building, rows and rows and rows of windows from the outside that you can see, which are extremely uniform, regularly spaced. You have very clean kind of angles and everything that are just basic shapes. And then um, just almost every single ward that I've been on has been on the inside one of two shapes. You either have the hallway style where you have patient rooms running on either side of you, so the left and the right, and the hallway is usually extremely wide and split down the middle by the rooms where you would put nurses stations and a Pyxis, which is the units where we lock up medications and sharps and that kind of a thing. And so all of the caretaker rooms would be down the middle, and then rooms to either side. Or you have the donut configuration, which is the nurses station and all of the facilities in the middle, and then the room in a ring or sometimes a square going around, surrounding that central, workstation area, plus medication room and stuff. So that either that hallway design or that donut design housed within a square or rectangular thing. And nowadays, now modern days, it's windows going down everything because we're really, really obsessed with getting sunlight into patients' rooms.
Is that what hospitals have always looked like? Think back to what hospitals looked like in maybe the early 1900s, the
Oh,
1800s.
okay. Well, I don't have to go back too far because Josh, you're a UCLA alum. I was at UCLA for fellowship, and I had come on a couple of years after the brand new hospital was built, but the old hospital was still there. And it was in the style, kind of in the previous old world style of wards. And it's the same very simple brick rectangular building, but the big difference from the outside is that we had very, like, almost like jail style windows. They were really, really small and usually covered with something. And yeah, on the inside, you could have on some of the wards, you could have what's called an open ward design. So, meaning that instead of individual patient rooms, they were just big open wards where you had the beds, kind of side by side. And the only thing really separating you from your neighbor was like a curtain. And there was a big walkway down the center. Oh, Josh, you remember Scrubs?
Oh, of course.
So yeah, the first ward that JD walks into and everything where they're rounding, it looks like that old school ward. It's just open in the middle. There's a nurse's station at one end, but your patient beds are just on either side, and it's just curtains in between
They're
the
all just
beds.
out in
That's
the
it.
open, kind of like
They're all just
today's modern ER.
right. Now, the only ward which stays that way in pediatrics in a modern hospital is our neonatal intensive care unit because
They haven't learned to talk, so they can't complain about the
well,
overcrowding.
well, no. Privacy is important for like mother baby bonding. So we do set up like little cubicles and stuff. But we found that for safety and workflow of the nurses there, they really do have to have an open word design. It's
All
much,
right. Well,
much better for the
we'll come
kids.
back to that later. Hold that thought.
Okay.
But I just want you
Okay.
thinking about your first gestalt image of a
Yes.
hospital. Because when you go
Yeah.
back, 19th century hospitals had the look of castles or of convents. One
Oh,
small
yeah. Yeah.
building that could admit a certain amount of people, but, maybe very narrow, dark, winding, you moved with purpose. The
Yes.
building was just there for the function. Then you get to early 20th century, we have a bit of an industrial revolution. Hospitals begin to resemble the noble public institution like city halls and libraries. Think about it. When we talk about the operating theater, it was a theater. People were looking in
Yeah.
from above. Like
Yeah.
you'd watch government take place at Congress or the House of Lords or
Mm-hmm,
the
mm-hmm.
Duma. So you have the hospital being a public institution with public spaces and private spaces and things for citizens to make use of. Then you get to World War II, and hospitals start morphing into office towers.
Oh,
These great
okay.
sweeping, some of the
Yes. Mm-hmm.
things, and the hospitals that you're describing, the ones that we saw were built in that era. And today, hospitals look like shopping malls or motels, or depending on your
Yes.
level of
Yes.
cynicism, like a Toys R Us. Think about what you
Yeah.
described: two hallways, all with a bunch of rooms. Now they have doors on them, but it used to be,
Yes.
it's like you're just walking down a Motel 6 where everybody's got their door open. They're laying in bed. There's a TV at the foot. There's a little tray for there, and you have your nurse call button, which is definitely not at all like room service.
Yeah. Exactly. Well, I think it did change not only depending on our technology, right? Because now we have remote monitoring where a nurse or a doctor can get a massive amount of information, even with the door completely closed, with monitors on the patient. Sometimes they're a neuro patient, so you've got, a video EEG ongoing. There's so much info that you can get just even with the doors closed and using, just a heart monitor on them. You've got their heart rate, you've got their respiration, you've got their oxygen saturation. You've got your ABCs like already set there. So you could put in doors and everything and it was okay. But I think the other thing really is that we switched from, hey, we need to make this as convenient as possible for the doctors and nurses to, okay, let's start focusing on the patient and their comfort and privacy while they're stuck in the hospital.
And
So,
yet, and
yeah,
yet, think about again,
yeah.
we go back to those castle convent looking ones. You
Oh,
were
yeah,
there to convalesce, to recover, to
sure.
take as long as you needed, and to leave when you and your caregiver both
Right.
sort of agreed. Then, as we start getting more into the office
Sure.
and public institution, and now, you know, the modern day, these super hospitals, the design, and I want to point again to your, and we'll talk why an open floor plan is still good, but
Sure.
it's a little bit more like a factory, right? You
Yeah,
have to
that's
you bring in your raw materials, your illnesses, and you
yeah.
create your finished product, a healthy patient that we release into the world at the end of the medical assembly line.
That's true. The idea also has shifted, Josh, where just like you were saying before, that hospital was a place to get all the way better before a person was released. What started happening more and more, though, is our recognition of what we could overdo and what we could do wrong and infections that could spread within the hospital itself. And we realized how much could be done at home in terms of recovering and convalescing. And so our paradigm now is to hospitalize only when necessary and for as long as absolutely necessary to do what needs to be done within those confines. And then when, a person is able to finish up their recovery, we found that it's much, much better to do so at home. So, get moving, get through there as soon as possible. And it does turn out that, shorter hospital stays, as long as you're keeping an eye on safety, is actually an admirable goal to have. You don't want that person to sit there and convalesce and convalesce. You want them to be able to get home.
So let's talk about the actual design part of it. To make a comparison with one of my favorite city locations, a zoo.
Okay, okay. Not that we're comparing our patients to animals, yes, but okay.
Before a zoo is built,
Yeah.
architects, designers, biologists, animal psychologists, and building specialists all collaborate to create an environment that optimizes living conditions for the animals. And this means you have to think about
Yes.
not just your construction materials, but vegetation, lighting. Animals will need enough space to eat, sleep, decide when
Hmm.
to be social or when to be private, and even their need for control over the environment and having an element of choice has been noticed. So you want to create an environment that supports the animal's physical, psychological, and social well being. As you
Okay.
mentioned, while thinking you were trying to save face for us. Humans, not like
Yes.
zoos, and do not seem to make the
Yeah.
same demands when a workplace or a place where they may be residing is going to be designed.
Sure, sure. Okay.
Nobody's thinking about my vegetation and need for choice.
Yeah. Well, we didn't. It used to really be a doctor and nurse centric type of hospital. I need the doors open so that I can get in there as easy as possible. I need all my patients close together so that I can just move from one to the other quickly. All these kind of things. But just like zoos, Josh, you said zoos did also shift from being, all right, we're just going to display the animal, just make it as Spartan as possible so that you can see the tiger. Now shifting over to, all right, if we're going to keep a captive wild animal in the zoo, then let's make them as comfortable as possible. And likewise, that same kind of change where we became more patient centric and realizing that their comfort and sleep and privacy is important, it started to shift how we built a room.
You know who one of the first people in medicine to start talking about shifting hospital design to be like zoo design was?
Like zoo
Well, not necessarily
design.
like zoo design, like what we've talked
Yeah.
about in zoo design.
Oh, gotcha. So comfort and all this kind of a thing. I'm guessing this is going to sound horrible. I'm guessing it's a nurse, not a doctor. um, I tend to
You would
favor,
be correct.
yeah.
Uh,
Now I
Florence
tend to
Nightingale.
favor Harriet Lane. Oh,
Hmm.
Florence. Yes, yes. Also wonderful. Sorry, Harriet Lane is from Johns Hopkins, the figurehead on the book for the nursing manual that you can carry around as a pocketbook. Great figure in the history of nursing, but of course, Florence,
No,
Miss
so yeah,
Florence.
Florence Nightingale developed a theory of healthcare that emphasized elements such as noise, lighting, and daylight are vital for an individual's health and mood. And this has continued to influence thinking even through today. Now, I'm going to jump back a little into the past. Today for you and me, Santosh, but apparently not for this Gen Alpha or whatever we're up to. But
Okay.
1989, there was a study at a
Hmm.
correctional institute in Michigan that showed inmates who had their windows facing the prison yard visited the hospital facility there more often than inmates who had windows facing the forest and fields. Um,
Oh, okay.
so that was noted in prison. But, of course, you could make the argument, or at least people made the argument, like, well, they're prisoners. Of course, they're going to try and visit the hospital for some reason. But why the ones who have a view of nature going less? So, one study from 1984 was actually really starting to be made a lot more of in the last decade or so. But
Okay.
it was the very first to show that patients in rooms with a window view may have improved recovery rates after surgery. Like literally just
Yeah.
having a nice view improves your healing. And and the study compared in view through a window may influence recovery from surgery. It's not creative, but it is to the point. Uh,
Yes.
one Two sets of patients were compared, one with wall views and one with tree views. And using
Okay.
clinical data, the patients with tree views had shorter postoperative hospital stays, fewer
Mhm.
negative evaluation comments from nurses, took fewer moderate to strong narcotics, and had
Mhm.
lower scores for post-surgical complications. That had nothing to do
Oh.
with the medications we were giving. In fact, we were giving slightly less. It had nothing to do with the presumed quality of healthcare giver. Literally, just having a room with a view let people heal faster.
Tree views, huh?
Not
Josh,
two
what about
views, not five
Yeah.
views.
Oh, you jumped the pun. Absolutely. Now, this goes together with data that we're gathering for emotional well-being and health really does affect our physical well-being, our ability to heal, rates of inflammation, right? And which is really important, especially post-op. And kind of stacking on top of that, that exposure to nature. So just like you're saying, fields, forests for us out here in LA, if we go out to Joshua Tree, which is a more desert scene kind of a thing, but if it's just untouched, non-human touched nature and peace and quiet and beauty, it really does increase our psychological well-being overall, and that certainly contributes to healing. And to be very fair, even coming through the 1960s, 70s, we were not acknowledging this brain body connection. It was a very kind of separate thing. Likewise, Josh, sleep, letting the patient please get some sleep and not rounding at like 5 o'clock in the morning kind of thing
But
was,
none of that's
more
the
and more important.
architecture aspect. I'm interested in just
Yeah,
put a window in the room, you'll heal faster.
sure.
So
And that's absolutely true. Yeah, yeah.
so in order to really look at this in depth, because remember this was back in the 1980s, and as you and I crumble into dust and the TikTok generation takes over, we want to know if it's still applicable. So
Okay.
Mitchell J. Mead, a health and design scholar at the University of Michigan,
Hmm.
looked at the impact that factors such as room features, the number of occupants per room, and the distance from a nursing station can have on patients' clinical outcomes, specifically in a surgical population. You'll note all of those things are by design. What's in the room? How many people are in it? How far are you? Nothing about what they're being given. So the study followed about 4,000 patients who underwent 13 different high risk surgeries like a colectomy, a pancreatectomy, a kidney transplant, any of those. And this all looked at patients admitted to the University of Michigan between 2016 and 2019. So, pretty recent.
Okay.
All of them,
Yeah.
after they underwent the surgery, were admitted to a room in one of two floors of the hospital. Every one of those hospital rooms had a code based on features like window versus no window, single occupancy, double occupancy, distance from nursing station, are you in line of sight of the doctors? They then linked patient encounters with each room number so they could see how the clinical outcomes varied per type of room design. And having a window, being placed in a single room, or being placed in close proximity to a nursing station all influence outcomes after high risk operations. You want to take a guess as to how much?
Mm, 5%.
20. Mort-
Whoa.
Mortality rates were 20% higher overall for patients
Wow.
admitted in a room without a window.
Oh my God. So, Josh, just to clarify, overall, just as a huge umbrella measure, it's estimated that antibiotics, like the advent of antibiotics, had an immediate, effect on survival. Just this when penicillin first came out of 30%, and we were celebrating. So this is a massive impact when it comes to measurables in hospitals. That that should cause such a ripple in kind of policy and design and architecture that immediately you got to go to all windows.
Now, what did you just say earlier in our episode about hospital design? Walls upon walls of windows.
Yes, yeah, absolutely. And I do want to give a shout out. We can talk about it in the just the tip, but Iowa Children's Hospital, there's a giant, beautiful picture window, and where all the kids can actually sit and watch the football games. It has become a first half tradition for the entire stadium to stand up and wave to the kids, at the big picture window, where they can come out, and even if they're in wheelchairs or whatever, they can sit and look out across the campus and see the football game. So,
So
yeah, yeah,
even
windows are um,
so this
huge.
effect, this mortality benefit was still observed even after they had looked at confounds like comorbidities of the patients and severity of surgery. Among patients
Okay,
in windowless rooms, 30-day
right,
mortality rates. So we're not looking at all-time mortality. Now we're just looking at within 1 month. 30-day mortality
sure.
rates 10% higher in the windowless rooms.
Oof, wow.
Now, here's the real
Uh
kicker. Although the team did see
huh.
differences in the mortality rate across different room designs, the mortality rates
Okay.
didn't vary by room type when only length of stay was taken into consideration, meaning these people got out in roughly the same amount of time but died sooner from not having a window. So it wasn't the amount of time spent in
Wow.
the hospital that accounted for differences in mortality. That is a massive, huge, huge benefit to see. So in the short
Yeah.
term, findings like this can help the room choosers. I would say, the article said doctors, but we all know doctors have no say in where the beds are. Um,
You're right. Usually the physicians like you and me who walk in, we had no say in
but
how this
but
thing
what
was
if we
built.
suddenly did? Because we can talk about the risk of a surgery, and then the bed
Yes.
control can figure out where they want to put them, so those that are most at risk can be given the best chances of pulling through. Imagine this is,
Yes.
of course, the nightmare dystopian version, but minor cases that are not life threatening, like, oh, having a knee replacement into the windowless basement with you, Pops. Whereas,
Yeah.
oh, cabbage patient and transplant, please right this way to our top floor ocean view.
Yeah. There's some of that. But thankfully, Josh, we also do have the alternative for that, the knee replacement patient that you talked about, for instance, is rehab. Well, okay, maybe even if they got the windowless basement room, rehab quicker, like a lot quicker, and get them home to finish their recovery and rehab as soon as possible. So that's another way to go. I I was feeling more strongly about that until you just told me about, the fact that the statistical analysis for that one study took into account hospital stay length, and it didn't it didn't make, as much of a difference as I was hoping. But yeah.
Well, I had found myself asking over the years, why certain surgeries were moving more and more to outpatient. And while this is probably not at the forefront of the minds of the various surgeons operating, I wonder how much of an influence it's had just subtly without us realizing.
Sure. Yeah, yeah,
Um,
yeah.
Now, more in your field, let's talk about infectious spread and how design can do that. We've talked again in the past about looking at things like bronze or copper bed rails or
Mhm.
where you put sinks in the room. But even just having a single bed room can help stop the spread of infections. This should sound intuitive, but
Yeah.
that's only because we've had several decades worth of people telling us this. So several
That's true. Yeah,
reviews.
that's sorry, go ahead, go ahead.
Well, no, I mean, like, patient rooms used to be, and a few hospitals still have two patients to a room. You've got a
Yes,
bunk
yes.
buddy who
Yeah,
may
yeah.
have other visitors coming in and out, um, who may have a disease that you don't have. You're certainly
Yes,
not
yes,
going to
and
catch a heart attack from your bunkmate, but if they're carrying an infectious disease, absolutely.
yeah, and it is it's a little bit kind of, no, I wouldn't say ironic, but it was scary that as the pandemic really swept through the past 2 years, there were many, many hospitals out there that previously did not double up rooms that simply had to because there were so many sick people. And in that case, we did have to use modern day knowledge and kind of wisdom to not just shove people in wherever they had to. We used modern systems, of actually like, uh, you know, co- actually coupled with like machine learning and things like that, these algorithms, which actually helped us place patients who, for instance, okay, if there were two COVID patients, all right, if they're both going to be COVID, they can both, share a room. It's okay. It's not like the COVID's going to make the other COVID more COVID. So we we found a way to do that kind of cohorting more safely in times of high volume like during the pandemic. So yeah, it was something that we needed to know
But
how to do
even for
well and quickly.
infections you don't think about,
Right.
catheter related infections have been found to be lower for critically ill infants in single bed rooms. When
Hmm.
McGill University hospitals in Canada redesigned their ICU from shared to private rooms, the rates of all bacterial infections decreased by over 50%. It also decreased the length of stay by 10%, probably because there's a lot less bacteria getting around.
Yeah.
Um,
Yeah.
and impacts like this were measured over 5 years by collecting information across three hospital databases. One database
Hmm.
tracked length of stay, another tracked every patient's infectious organism screening results on ICU admission, and the third
Hmm.
recorded any infections 48 hours after admission, meaning the patient probably arrived with an infection, to
Yes,
48
yes.
hours after discharge, meaning they likely left with a hospital acquired infection.
Right, exactly. So those windows, especially for infections where we really know the incubation period well, we can use those time periods to plot these kind of before and afters pretty well.
So, thanks to results of studies like this all through, let's say, the 70s and 80s, the private patient room, which used to be seen as a luxurious
Hmm.
amenity, is now standard. Most people are furious if they have to share a hospital room. And that is not how things used to be.
Yeah. I will say, Josh, I don't know how international our listenership is. I hope there are folks from all over that are listening. We are talking about, by and large, the Americas, so the United States, Canada, and probably a huge chunk of Western Europe. Now, Josh, in places where resources are limited, right, and they couldn't build or revamp new hospitals and this kind of a thing, the old way of doing open wards and stuff are still very much the norm because as much as we like all of these individual rooms and everything for infection control and privacy and comfort and all these kind of things, the open wards where you can just put the beds in rows are infinitely cheaper. And sometimes that's what's important because you just need to be able to accommodate the patients where you have a low resource area.
Well, let's talk a little bit about those open wards and how design can even affect how fast your nurse responds to you.
Yeah.
Because let's think about some of the things that really get in are just standard obstacles for nurses. Um,
Okay. Yes. Uh huh.
when you're talking about the
We're not talking
spatial,
about like speed bumps. Yeah. No.
oh my gosh, nursing speed bumps.
No.
But no, no,
You
no,
know when they
no.
like,
The spatial,
yeah.
the spatial configuration of the unit. So
Yeah.
for this study that I'm going to talk about, nurses' work areas were divided into four categories: the patient's room, the nurse's area, the corridor or hallway, and
Hmm.
specialized areas like a storage room or medication. Incidentally, another design thing, um, low lighting levels versus high lighting levels in medication dispensing areas. High lighting levels, fewer medication errors, shorter length of stay.
Yes.
Again,
Hmm.
simple design feature that you don't even think about until it's not there. But back to the four nurses areas. They were found to
Yes.
generally follow three paths in their trips, from moving between a point in the nurses area, a trip to the patient's room, and back to the nurses area, and a trip between patient rooms. So
Hmm.
when trips were organized according to functional logic, the majority of activities performed by nurses were found to last less than 2 minutes, which means that on a surgical unit, nurses during one shift can move about 4,000 trips that each last about 3 minutes and 25 seconds each. And this, because surgery units are probably designed very efficiently for the surgeons, is fewer than the 4,500 trips performed by nurses on the medical units. Just from where
All
you
right.
put the nursing station to get to the patient's room to get down the corridor to the next patient's room, to get to a med or storage room, and then back. So just looking at the paths they were taking and seeing how long those trips would do. So that is what you see a lot more with those big donut stations that you used to see, and also what you see in a typical medical ward outside the American system.
It is so important to make life easy for a nurse to get from where they are organizing their information, you know, kind of planning out a task or several tasks sometimes, uh, getting the materials that they need. So, whether that's needles or meds or whatever it is, and getting to the patient room, it's so important to have that as smooth as possible, because you need to be able to change that for if there's suddenly a rush of emergencies, if it becomes very busy, and likewise, just physically moving from spot to spot, they're taking so many steps, Josh, is it's a workout. So you've got to make it as like kind of ergonomically kind of fit as possible, or you get burnout, right? And you get nurses quitting because all of a sudden, for some silly design things, their work can be much harder. And especially when you have something like, oh my gosh, then a pandemic happens and you have to very quickly shift things and increase your patient volume by 2 times, 3 times, it can be absolutely disastrous. So that is super important. And that's why actually nursing has to have a lot more input on this design than doctors do.
So, one way to better meet patients' needs and address some of these obstacles is not to have a single central nursing station. Instead,
Yes.
there are several decentralized workstations throughout the unit with supplies, linens, and equipment areas. So, like little caches, like you might see in a video game, or where you'll see a lot of nurses just charting using cows, not the animal, the computer on wheels.
Yeah. Yeah, you can do it one of two ways. You can put a few computers on wheels, or what we went out and did, Josh, which was just buy a ton of cheaper workstations and just put them friggin' everywhere. So there's a smaller portable workstation in the patient room, and then there's a dual workstation outside. And just like you said, you can put quick, easy to reach items that you need very quickly, like at that station that's right next to the patient room. So, gauze and band-aids and, the quick and easy stuff. And then if it's a controlled substance or a needle or something like that, that can be in more of a central lockup. So now, for the regular quick, I need these right now and it's not a big deal kind of things, boom, it's right there and anyone can grab it and put it.
The right
Mhm.
materials can go a long way to make design healthier. And this we talked a little bit more about in our disease influencing design. But non porous materials like tile and porcelain reduce the potential for contaminants and having a
Yep.
clean, sterile environment. Tile also doesn't emit any potentially harmful substances that are a risk to human health, such as VOCs, formaldehyde, PVC allergens. In fact, if we go back to one of my favorite periods, the Victorian period,
Yeah.
and you just
Uh-huh.
look at classic literature from that era, you know, people are just randomly falling ill all the time. Oh, someone's caught the vapor, someone does this. But
Yeah.
Santosh, their homes were stacked to the roof, the literal roof, with arsenic, asbestos, lead, radium. I mean, of course they were sick all the time.
Yeah.
And
It
then
was it was a bunch of toxic materials being shoved into homes like just like way too quickly. And interestingly, Josh, it because usually we're used to people who have more poverty, right? If they have less money and everything, getting sicker more often. This was all of a sudden the rich getting very sick.
they're like, "Oh, we took my ill wife to the seaside and her condition improved remarkably." It's like, Edward, Your house has 7 time bombs in it. Please just leave your wife at the seaside and she'll do very well not getting mesothelioma.
Sure, absolutely. I think, Josh, that materials that you were talking about, super important, absolutely non-porous, but much more importantly, non-absorbent, right? So if something spills, you can clean it up quickly and completely, and whatever it is, if it's a biohazard like fluids, right, like if it's blood, you can get it completely off, you can sterilize the surface with no problem. And some things we don't always think about, but we can also dry it after that so that you don't slip and fall, which is another hazard that you have to try and avoid.
But
Yes.
these ideas that we've been discussing about how hospital design is being influenced in terms of the patients are, I can't say universal. I don't know what they're doing on Mars, but they're certainly global. Um,
Okay. Yes.
let's look at the Butaro District Hospital
Okay. Where's this?
in Rwanda.
Oh, okay. Okay. So probably very, very different in terms of money and resources, like what they have access to in order to build.
I want you to go ahead and pull up some photo designs. Just go to Google
Okay.
Image, pull up the
Okay. I
design of
gotcha.
Butaro Hospital, and
Butaro
remember
Hospital,
and
District
remember what you
Hospital.
told me in the beginning
Yes.
about what you pictured when you closed your eyes and thought of a hospital.
Sure, sure. Okay, so I'm pulling this up. Oh my gosh. So the first thing I see is from Wikipedia, a very beautiful clean lawn on the outside. It seems to be up on a hill. And this hospital is actually, this looks more like a campus. So rather than a single building, you actually have several detached buildings. And it has some design features which we don't usually think about in a modern Western hospital. Slanted roof. We usually have flat roofs, primarily, Josh, now because we have helipads, right? We have helicopters landing on top of our hospitals, not just for fun. They're bringing patients in, but this one has slanted roof design. I do still see lots and lots of windows on the outside. There is one prominent building which is beautiful. It has a stone exterior. So rather than brick or, like flat slab that we're used to seeing out here, it has a beautiful pebbled stone. And then walkways in between all of these buildings. Most of them look to be one story. So they're single story, long, kind of narrow buildings, side by side, but kind of bending around and then ultimately forming a ring of a campus with a courtyard in the middle. This looks absolutely beautiful, and I can kind of see the function of it too.
So, yeah, let's. It's in a rural mountainous region of northern Rwanda, and
I do want to say sorry. I just saw the inside. I just saw the inside. It is an open ward design, so beds side by side, and one very a huge difference from what we would have here in the United States, which is absolutely essential in Rwanda, is every single bed has a massive mosquito net over it.
stakeholders, when this hospital was being built, asked why should it follow traditional layouts, with patients lying with their heads staring at the exterior wall while doctors and visitors have views out the window behind them? What happens
Right,
when
right.
sick
Oh,
people
that's
have what happens when sick people have a view of the countryside instead of staring at other sick people all day long? Uh,
sure.
so if you'll look, since you said you saw the inside of the wards, you can see the beds have their head alongside a very narrow little wall that runs separating like 15 or 20 beds uh, back to back or head to head. And each bed
Mhm.
faces out on its own window and then has a little chair there for visitors.
Oh yes, I see that. I see. Okay, so there's a dividing wall. They decided to use a beautiful orange and then spick and span floors. But yes, the
And you
pillow.
also see And it also looks out onto a central inner green courtyard where there may be kids playing. So there's also a
Yes.
little community center that works from there. Another thing they thought about is why employ traditional designs for ventilation when they depend on a power grid
Okay.
that often fails, exposing patients to
Oh,
airborne
I see.
diseases that make them sicker than they already were.
Okay, okay.
So, what Butaro did, it was designed by an architecture firm called Mass in cooperation with the Ministry of Health. It cost $4 million, and the construction of the 150-bed hospital began in 2008. It opened in 2011. They used
Okay.
wherever possible local materials, including volcanic stone. That's that fancy gray building you see in the center. And they
Okay. Okay.
actually
Oh, yeah.
have, and they focus on maternal health as well as their ambulatory cancer center.
There is a beautiful layout, like an overhead view here. So I do see, just like you said, ambulatory unit, and then the wards that I see are pediatrics, post-op, neonatal ICU, delivery, pre-delivery, another pediatrics ward, and a post-delivery room. And then they actually have a separate ward called a men's ward. So very uniquely, the
Right?
men's ward is completely separate and away from the other buildings. It's actually all the way at the other end of
Now,
this narrow, like oval shaped courtyard. So
because we're a bunch of
this is a women
filthy
and
creep.
children's hospital.
But let's talk about the ventilation now. All hallways in the hospital are located along the building's perimeter, so patients and staff can move throughout the hospital in open air. So rather than doing isolation negative pressure rooms, you have the inside, but if the power grid fails, how are you going to keep air moving? Well, your hallways are outdoors. Inside, you have a large window with a view of the landscape, as well as natural light and ventilation. Cross ventilation is supported through the use of high volume, low speed fans, large windows, and very high ceilings to circulate air comfortably, reduce the risk of reinfection. And in each ward, ultraviolet germicidal irradiation lights neutralize microbes as air is drawn upward. So a little bit of the reverse grid that you see in the Mission Impossible movie.
Oh,
Um,
this is so cool. So that's actually why they have that slanted ceiling, is because you needed high up windows and low windows so that the convection currents would move that way. So you could open the high up windows on one side and then the lower windows on the other, and you'd have continuous airflow. That's
you also
so cool.
have circulation of cool air through the wards due to those outdoor hallways and the draining of rainfall away from the
Yeah.
building. They also added trees and shrubs to stabilize the hillside that also create shaded areas that encourage patients to remain outside where the chance of airborne disease is reduced. You're actually subtly encouraging patients to move themselves outdoors rather than sitting in their hospital bed.
And we do value that absolutely here in the West. That one of the first things that we do for a patient on our pediatric ward when they are convalescing and they're getting better, but they're not ready to leave, is we get patio privileges. Like ASAP, and we set up a beautiful, garden outside of the children's ward that actually does have a bit of a fence around it, so they could have some privacy with their family. But yes, we're recognizing it probably a little bit later than the folks out in Rwanda, or that you have to get the folks outside, just move out as much as possible. These folks out here, when they designed this, they designed it from jump to have most of the patient's care, like most of their day, go outside and enjoy the sunshine.
Now, I'm giving you another link to the
Okay.
doctor's housing, the call rooms, as it were.
Oh yeah. Okay, gotcha. So this is close by.
This is right up the hill.
Oh, gotcha, gotcha.
In
So this
fact,
is
if you look
surrounding
at
the hospital.
yeah, and they look like what people are desperate to see on HGTV when it comes to tiny houses.
Yeah.
tiny housing.
Yeah, they are just really tiny, and they kind of dot the hillside because this is all on, like, I guess, hills.
Within walking distance of the hospital and close to the other doctors. So if you need to consult, you have your own private area. They're all designed by stabilized earth blocks. And again, this is all semi permeable housing materials, trees, bushes, rather than hard packed dirt that can end up turning muddy or forming pools of standing water. Just thinking about the design of a hospital can actively influence a wide range of things. And when you get a chance to, as you say, build it from the ground up, look at all these improvements that you didn't even realize were contributing to the healing process until we did an episode about it.
I absolutely love it. I always do think of the hospital environment from the standpoint of infection control, and also to some degree antibiotic stewardship, meaning, how and where we dispense medication. Likewise, isolation for airborne disease and this kind of a thing. But this seems to encompass so much more in terms of the holistic view of how the patient heals, gets better, how they're cared for. And especially, Josh, in this particular instance that you pointed out in Rwanda, just because it's an open ward system, right? What that we would think of here in the West as passe, that doesn't mean that it's worse. This can be a beautiful place to heal and get better, especially for kids, because, you come to the bed in order to sleep and to receive maybe your meds for the day or something like that. And then the rest of it, if you have an IV pole and that kind of a thing, you hang it up, wheel it outside, grab a bench. It's totally fine. And almost certainly, as long as the environmental dangers are not a problem. So soil contamination, water, that kind of a thing. If we're able to control for that, then absolutely outdoors is best. And this was so well conceived, in terms of not only taking care of the patients, but using the local resources and the local environment and climate to the advantage of the doctors, the nurses, and the patients in order for everyone to work at their best. This is absolutely beautiful. I want to visit here, and I think it would be an absolute pleasure to go. Yeah.
So there's a
And
lot of
if
medicine and design left to cover.
Yeah, and from my particular standpoint, Josh, super important is play areas. How you design areas for play, pick toys and games in order to populate those play areas, and then because I'm an infectious disease doctor, also how you still keep the areas clean and stop diseases from transmitting. You know, even though you're like, giving a box of checkers to a kid, especially if you're a 3-year old, because that thing, those are going straight in the mouth. And that goes into the beautiful science of what we call child life, which is a specialty that you can get into if you like working with kids in hospitals.
So that's it for this week. Join us for future episodes of Design and Medicine. As always, we love to hear your comments, questions, and feedback. The show is produced by me with a lot of help from Dr. Santhosh and friends. Our theme music is composed by Rachel Leisure. If you'd like to support us spiritually, emotionally, or financially, you can find links to do that in the show notes, as well as links for further reading. You can support us on Acast Plus. Thanks to all of you who are doing it. Keep a song in your heart, soap on your hands, a shot in your arm. Find a country to go to that looks interesting. Maybe Rwanda, maybe somewhere
Yeah. Oh,
else.
yeah.
As always, happy travels.
Bye, everybody.